My name is Katie Murray, and the focus of my research is gun safety among school-aged youth and its relation to nursing. This topic gained prominence in 2023 when the American Nurses Association endorsed gun violence as a safety issue. My interest was piqued by personal observations of gun violence reports in my community and the opportunity to speak on a panel about gun violence. The primary aim of my research is to identify policies that nurses can influence to reduce firearm injuries and fatalities in children. Despite the urgent need, there is a notable lack of comprehensive policies addressing gun safety in schools. Current efforts are inconsistent and insufficient as evidenced by my literature review. There is a significant gap in interdisciplinary collaboration on this issue, particularly involving nurses, school officials, psychologists, behavioral health professionals, police, and policymakers. Some objectives and aims of my research are to assess existing policies that nurses can impact to reduce firearm injuries and fatalities among children, foster conversations and partnerships among various stakeholders to address gun violence comprehensively, advocate for consistent gun safety policies across all states, particularly focusing on child access prevention laws, and to emphasize the critical role of school nurses in addressing gun safety and policy implementation. Some ways that I have approached this research is by participating in panels, which also involved other disciplines such as psychology, sociology, and criminology, as well as a literature review where I searched for articles on gun violence in youth using Google, government websites, and CINAHL, focusing on publications from the past 5 years. I've also examined government documents such as the Gun-Free Schools Act to understand current measures and their impacts, and identified gaps and inconsistencies in existing policies, particularly focusing on the implementation and effectiveness of CAP laws across different states. Some things that I have found in my research is significant variation in gun safety policies across states, particularly in the definition and enforcement of CAP laws, insufficient involvement of school nurses and other health professionals in policy discussions and implementation, and also an increasing recognition of gun violence as a critical issue, but comprehensive interdisciplinary action is still lacking. The findings highlight the urgent need for standardized, comprehensive policies to address gun safety in schools. Nurses, particularly school nurses, can play a pivotal role in this endeavor by advocating for consistent and effective measures. Moving forward, I hope to continue investigating the effectiveness of current policies and the role of health professionals in policy advocacy, as well as building stronger partnerships among healthcare providers, educators, law enforcement, and policymakers, and to work towards unifying gun safety policies across states to ensure consistent protection for all children, and to increase public and professional awareness about the critical role of interdisciplinary efforts in preventing gun violence. Thank you.